What is AxSpa, or axial spondyloarthritis? This is a short presentation from the Coventry AxSpa team to try and improve your understanding of the condition and what it means to you. All of this information is based on the National Ankylosing Spondyloarthritis Society webpage, which you can look at for further information and more detail. So what is it? AxSpa is an inflammatory arthritis that mainly affects the spine. It can cause inflammation of the tendons and ligaments at their attachments, which is also called the enthesis. This can impact on the spine, but can also affect the ribs, the sacroiliac joints, which are down near your tailbone, and other tendon attachments around the body. One of the hallmarks is the formation of new bone, which can contribute to joint stiffness and associated pain and swelling. Now, there are two types of AxSpa, or two classifications. The first one is radiographic AxSpa, and this is when changes, particularly in the sacroiliac joint or spine, can be seen on an X-ray. And these are very specific to this condition and different to those associated with other conditions such as osteoarthritis. Non-radiographic AxSpa is when these symptoms are not seen on an X-ray, but inflammation may be picked up in other forms of investigation such as an MRI scan. Therefore, there are symptoms suggestive of inflammation that have not progressed to radiographic changes yet. Now, everybody can experience symptoms differently. However, based on research findings, there are some typical symptoms that are experienced by the majority of patients at some point during the progression of their symptoms. Initially, it tends to be back pain that starts before the age of 40 years. It is a slow or gradual onset with low back pain and stiffness, which can progress slowly over weeks or months rather than a rapid onset in a few hours or days. The early morning stiffness can be more than 30 minutes, and that can wear off during the day or with exercise. The symptoms have persisted for more than 3 months and tend to be persistent rather than coming on in short attacks. They tend to feel better when they're after exercise and worse with prolonged rest, such as sitting, driving, laying in bed. There can be some associated fatigue and tiredness. Some patients attribute this to a change in sleep pattern or the impact that the symptoms have on their general well-being. Pain generally can cause waking in the second half of the night, so this tends to be from 1 or 2 o'clock in the morning onwards, when you've been laying in bed and you've been still for a period of time, and with the accumulation of inflammation, that tends to cause more waking in the second stage of the night. This tends to improve with anti-inflammatory medications in the first stages, such as over-the-counter medication, ibuprofen, and there may be a GP prescription for some other forms of anti-inflammatories such as naproxen or etracoxib. And classically, patients tend to experience flares in symptoms where they can have some relatively good phases and may have some other episodes where symptoms feel to flare or become more difficult to manage. Now, the National Ankylosing Spondyloarthritis Society have created a very handy acronym for their Act On AxSpa campaign to try and improve national awareness of the condition and to help try and identify symptoms early. And this is as follows: spine, symptoms starting slowly, pain in the lower back, improves with movement, nighttime waking, and early onset under the age of 40. Now, despite a widespread lack of awareness of the condition, AxSpa is not rare, and it affects approximately 1 in 200 to 220,000 people of the adult population in the UK. That's twice as many as multiple sclerosis and Parkinson's disease, which you may have heard of, be more familiar with. The average age of onset is reported to be 24 years. And it tends to be known as a condition that affects younger people. The unfortunate average time to diagnosis nationally is still reported to be 8.5 years. Now, this has an impact on progression of symptoms and some of the irreversible damage that may have been caused by symptoms prolonged and being undetected. There is a large movement across the UK, including within our service, to try and drive down a reduction in the diagnostic time, particularly in our area, to try and improve access to treatment and patient awareness of the condition. Now, it is reported that up to 59% of people with AxSpa do also report some other mental health symptoms, which is compared to approximately 25% of those reported with other musculoskeletal conditions overall. There are many factors for this, but it is thought to include the impact this has on your general health and multiple systems. For some patients, it may not just be spinal disease, and this can have an impact on their quality of life and general well-being. So what are the key facts? It affects approximately 1 in 200 adults in the UK. It is of an equal prevalence in male to females with an equal ratio of 1:1. It commonly starts between the ages of 18 to 30 years with an average age of onset of 24 years. Now, you may have heard of the HLA-B27 gene. 85 to 90% of patients with AxSpa do carry the gene, but only about 1 in 15 people that are HLA-B27 positive go on to develop the condition. This means that the gene alone is not responsible for people developing AxSpa, but may contribute to it. It is now believed that over 100 genes are involved in the condition, and that HLA-B27 is responsible for no more than 25 to 30% of the genetic risk. It is reported that 91% of the population have never even heard of the condition, and the average time to diagnosis is 8.5 years. Now, as previously mentioned, this is a condition that primarily can affect the spine, but there are also other areas which we class as extra-articular manifestations, or EAMs. These are other areas affected by the disease. Classically, for the eyes, there's an inflammatory eye condition such as uveitis or iritis, which can cause inflammation of the eye. This may be something you're already familiar with. However, if you've not heard of this condition and you do struggle with inflammatory, sore, red or inflamed eyes, it is very important that you contact your rheumatology helpline for further advice on this, as it is deemed a medical emergency which would need rapid attention. Symptoms can also affect the gut, so some patients also have an inflammatory bowel disease such as ulcerative colitis or Crohn's disease. It has an impact on the tendons. As mentioned previously, it can cause an enthesopathy, so where the tendons attach to the bone, that's called the entheses. Now, inflammation can cause change around the tendon and the tendon attachments. Classically, for AxSpa patients, this tends to be the Achilles tendons around the heels, the patellar tendons around the front of the knee, and some patients also have it in their elbows, where they have a tennis or golfer's elbow type symptom. And another extra-articular manifestation is the skin. So we have a link with psoriasis. Now, psoriasis is an inflammatory skin condition that can cause red, scaly, dry patches of skin. It can affect the scalp, the nails and large areas of skin, classically the forearms, fronts of the shins and around the trunk. Now, if you were unsure if you do have any psoriasis features, it's very important that you show them to your rheumatology practitioner at your next appointment or your GP, as it may have an impact on the management of your condition. So most importantly, what do we do about it? We know that the best management options are a mixed approach. There is a large amount of evidence to support the use of exercise to help with management of the inflammatory features, the joint stiffness, the pain, and muscle weakness that can be associated. Self-care is also extremely important. We've touched on the impact on mental health, but it can also have a significant impact on your general well-being, your ability to work, function with your family, complete hobbies, interact with general family life, including going away on holiday, or just normal day-to-day activities and caring for others at home. Looking at ways to help your own personalised self-care approach is where, as a team, we can support you on this. And medication. There is a role for medication, and we are fortunate that we have access to a number of different medication options within our team. This can include the anti-inflammatory medication, pain relief support, and access to biologic drugs. Now, this is something we will discuss in a separate section to explain further the role of the biologic drugs and how they may impact on your care. So, what are the specialist services in Coventry available to you? We now have a specialist AxSpa clinic, which is led by our consultant, Dr. Tim Blake. He's a consultant rheumatologist. It will also be supported by myself. So, I'm Catherine Tonks. I'm an advanced clinical practitioner physio in rheumatology. So, I will also support on the consultant follow-up and new patient appointments and within the physiotherapy team. We have access to Kia Young, who is our clinical specialist physio in rheumatology, and he can support on the day physio and self-referral to rapid access physiotherapy support when needed. We have our clinical nurse specialist team. This includes Sister Parveen Bell, Vivian Montgomery, Sab Kular and Sibia Bipin. And these are the nurses you may have already met or be familiar with your follow-up appointments and access to the nurse helpline. We are very fortunate to now have a Coventry NAS branch with access to hydrotherapy. Within our team, we have created a self-referral route to physiotherapy. Should you need any access to physiotherapy or any advice or support, we have the patient email address, which is myaxspa@uhcw.nhs.uk. We also have the patient helpline number 02476 965 723. Please contact us with any questions or concerns and we can direct you appropriately. Here is further information on the Coventry Hydrotherapy NAS branch for water-based exercise. If you would be interested in attending, please email coventry@nas.co.uk and we can give you further information regarding this. It is based at the West Coventry Academy CV4 9GD and this is run by our own members of the Coventry NAS branch and committee, which we are very grateful for. That concludes the session today. I've given you a brief overview of what is AxSpa and what it may mean regarding your access to information and services within Coventry. There will be further information videos regarding this condition. I will also have access for you, including the medication management, how to manage flares. If you have any feedback or would like any further information regarding this, please contact us on myaxspa@uhcw.nhs.uk. Many thanks.